Thank you for joining us for this series on navigating the transformation of the quality measurement landscape. I'm Reid Kiser, co-founder of Kiser Healthcare Solutions. I welcome you to what will be a succinct but informative series of 10 quick videos over the closing months of 2020. We'll start off with setting a base foundation to define this transformation and then build up from there on what it means for quality measurement and the larger stakes of streamlining healthcare data exchange, scaling value-based payment, and ultimately improving patient outcomes. Now, these are succinct, but if we had more time, we would share more of the outline of each of these series, so stay tuned for what comes each week. And also, during these sessions, we're not going to share all the secret sauce. We truly value your time for joining us in these quick videos, and we are going to do our best to keep them short. So please engage with us for more details offline or through comments. Expect roughly a video per week over the next couple months through the end of the year. We do have the goal, and that is to get your interest to really learn more about our capabilities and how we serve multi-stakeholders in this environment. We can do entry engagements even as simple as looking at assessing what your organization needs are and what you need to know, how to evolve, and how to build your roadmap during this quality measurement transformation. And I will say this, based on our past client engagements, you have our promise that you will definitely come out better informed and better prepared for the future. So, all right, let me share the stage and introduce you to what I call our super band of rock stars. So now let's introduce the 4 pillars of our super band. So I'm Reid Kiser, bringing in the healthcare quality landscape, convener, connector, and problem solver perspectives to this transformation. Mariyah will be talking about or representing payer data, quality measurement, regulatory requirements. Michael Klotz, rejoining us this year, will be representing digital health, clinical data ecosystem, interoperability, and digital quality measures in his expertise. And last but not least, will be Monica Cunningham, joining us with the enterprise information view, as well as workflow across multiple stakeholders and operating models. So now let's go around this table. Let me ask a few questions just to introduce our rock stars for this super band. So Mariyah, can you talk about your firm and how you support KHS?
Hi, Reid. Very excited to be here. I'm Mariyah Badani, and my firm, Making Strides Consulting, partners with KHS, where we play a role of subject matter experts as well as project leads for everything healthcare quality and performance measurement. My expertise is all kinds of measures, be they HEDIS, HRQ, CMS Corset, URAC, and anything required by CMS or state. From an expertise perspective, I work closely with health plans, so I have an understanding of payer data, be it a gap analysis, performance measure, reporting, risk adjustment, but also detailed input about supplemental data, how they can really tap into other sources like aggregated data to be able to improve their metrics.
And Mariyah, I understand you're also a certified HEDIS compliance auditor and have been involved with many Medicaid states.
That is correct. I am a certified HEDIS compliance auditor. I've also been the NTQA practice leader. So I have a little bit of a deeper insight into NTQA HEDIS measures, as well as having worked with more than 16 states in the external quality review space, has given me more of an understanding of some of the challenges that health plans and regulators face when it comes to quality measures.
Great. No, it's great to have you as part of the team, and thank you for joining us. And then next, Michael Klotz. You may be familiar with him from our prior series, but Michael, do you mind talking a little bit about your firm and how you support KHS?
Sure. Hi, my name is Michael Klotz. I work mostly actually as a consultant through firms like KHS, who have an established brand. My primary focus areas are payer systems, what we call the clinical data ecosystem. And in other words, I do strategy work on software and software as a service with vendors, health plans, and occasionally other organizations. My areas of expertise are payer functions, quality measures, gap closure, care management, risk adjustment, and payment integrity. to name a few, as well as interoperability, which includes standards, regulations, and technologies, and last but not least, digital quality measures, which I'm very excited about.
Yeah, so Michael, I understand you're also involved with NTQA, as some may know, my old stomping ground, focusing on digital quality measures, right?
Yeah, that's right. It's very fun and rewarding to work with NTQA so closely on digital quality measures. I'm currently contributing blogs to the digital measure community, which launched back in June. And they also had me join the faculty of the Digital Quality Summit, which was virtual this year back in July. But it was another great opportunity to be involved with NTQA.
It's great to hear about that connection. And once again, thank you for joining us again with this new series. And last but not least, Monica Cunningham. So I'd like to share a little bit more about your firm and how you support KHS.
Thank you, Reid, for inviting me to partner with KHS on this transformation and quality measurement video series. And hi, everyone. I'm Monica Cunningham, principal of InteropRx LLC, a boutique consulting firm that works collaboratively with multi-stakeholders within and across organizational boundaries to advance the capture, management, use, and exchange of shared business information. Based on over 20 years' experience leading enterprise-wide initiatives for health plans, a health system, provider network, and a national employer benefits firm, InteropRx assists organizations who face gaps between workflow and data quality. Our track record is based on addressing these challenges, especially when the involved information is critical to the organization's performance, competitiveness, and viability.
Monica, so we met back at CAQH, another nonprofit organization that's leading change in electronic healthcare, and connecting to your work with industry educations. I'm curious, what do you see as the opportunities to bring the industry together, recognizing multi-stakeholders will need to work together on this transformation?
That's a great question, Reid. You know, perhaps there is a similar opportunity for a multi-stakeholder nonprofit convening entity to spearhead an effort to support and facilitate the transformation to digital quality measures across measurement platforms. And further, perhaps our viewers today would have an interest in commenting, and we could report back on those results.
Yeah, no, that's a great idea. We're looking for audience input. So audience, please put your comments on who that entity could or might be, or if it's a new entity, what would that look like? So Monica, thank you as well, and thank you for joining us. And now I'd like to just kind of, in closing, go around the table one last time, and I'll come back to you, Monica, just in transition. But what do you hope our audience gets out of this series?
I hope that we're effective today in collectively communicating our excitement for the shift to digital quality measures, as the benefits of that change will improve measurement quality overall and facilitate faster and more efficient data reporting operations. And I hope we can build upon this work that we're beginning to do together.
Great. And next up, Mariyah.
I'm excited about the opportunity to be able to share with our viewers that we at KHS understand the challenges that go into performance measure reporting, and to be able to accurately reflect the effort that health plans are putting in to service their members, but sometimes it doesn't get reflected in their measurement and reporting. So with this new shift with digital quality and to be able to use more aggregated data, I want us to be that point that people can reach out to say, hey, help us. We know we can, to be able to provide the guidance to navigate this maze of information.
Great, great. And I'll let Michael go last. So I'll say that I would like for everyone to gain a good understanding of just how fundamentally interoperability and DQMs are changing the quality and data operations for health plans primarily, but also for other stakeholders as well. And it really will be a multi-stakeholder transformation. And Michael, would you like to close it out with your thoughts?
Yeah, I want to echo the excitement. I think people who know me know that I've been following interoperability and digital quality for a number of years now, and so this is exciting times because things are falling into place very nicely as far as I'm concerned. And what I want people to take away is that now is the time to absolutely engage and understand where digital quality is going, where interoperability is going, because the opportunities for health plans and other stakeholders are tremendous, way beyond just the remaining compliant, which of course is something that you would have to play catch up if you don't get started soon enough.
Well, great. Well, thank you all for joining and doing your introductions here today. In our next session, we will start setting the foundation and really providing that terminology for the digital era. So thank you everyone in the audience for joining us. Please like, comment, and share. And we look forward to seeing you at our next session.